Hello friends, today we are going to discuss dropout and what are the causes of discontinuation of IVF treatment. The basis of our discussion is a review article which has been written by Dr. Fernando, and it's a review article which has involved 12 studies and has studied more than 15,000 participants from 8 countries. So why is dropout important? If a patient undergoes more IVF cycles, then it triples the chances of IVF compared to a single cycle, and dropout is the biggest reason of patient not being able to achieve their full potential. So what are the stressors and what we can do about it? So the biggest stressor that the patients have is physical discomfort. That is, they feel that the treatment is too taxing on their body. This can be reduced by reducing the number of intramuscular injections that the patient gets and make the protocols more patient friendly. There are family demands on the patient which creates a lot of stress. So we can discuss with the family and with the patient and help them in reducing the stress. There is a fear of failing. This can be done by doing a good pre-IVF counseling and giving them expected IVF success rates and not giving them unrealistic expectations. There is time pressure, and this can be done by reducing the number of visits that the patient has in an IVF clinic. There could be economic burden also, which the patients can be helped by giving them some kind of discounts if the IVF cycles fail. What are the stress symptoms patients have? They have acute tachycardia and they have cold extremities. They can have eating disorders. They can have weight loss, irritability, too much of fights between husband and wife. They can have tiredness, not being able to do any work. They can have anxiety and they can have sexual difficulties. And this is essentially because of the stress, which releases a lot of adrenaline and cortisol in the body. 50% of the patients complain of stress as the major reason for dropout. The strategy is to reverse this stress, which will help in increasing the chances of pregnancy by reducing the dropout. What do most patients say all across the world? Patients say that infertility is taking too much toll on our relationship. I'm too anxious or depressed to continue. It was difficult to get to the IVF center so often. I had already given my best chance. I could not stand the side effects of the medication. So these are what most patients say all across the world. Now, what is the role of healthcare workers? Every patient should be given realistic expectations. We should not give them too much expectation because later it will have heartache and then a dropout. Every treatment protocol should have a counseling session. Patients' psychology should be handled very carefully, and mitigation of stress can help in reducing the dropout and increasing the chances of pregnancy. Thank you.